Today, HIV remains not only a global threat, but also the leading cause of mortality in African women aged 15 to 44. In over 20 African countries, HIV is twice as prevalent in young women as it is in young men. And in Cameroon, young women are 5 times more likely to have HIV than young men. One cause of this HIV gender gap is economic. Due to limited job opportunities, women who experience a negative income shock often turn to selling sex to make ends meet, putting themselves at higher risk of infection. Alternatively, some women may seek financial support from older men, known as sugar daddies, in a practice called transactional sex, to cope with negative income shocks. Despite receiving emotional and financial support, unlike female sex workers, these women often neglect condom use and lack access to HIV prevention programs. Additionally, risky sexual behaviors tend to surge after economic shocks, like high health expenses, a frequent occurrence in Africa. For instance, 4.7% of households in Cameroon face catastrophic health expenses every year. The question is, could formal health insurance be a game changer in preventing HIV amongst women in Africa? Health insurance could improve financial protection by reducing catastrophic health expenses, potentially resulting in fewer risky sexual behaviors and lower rates of HIV and other STIs. This is what a group of researchers from University College London addressed in The Effect of Protecting Women Against Economic Shocks to Fight HIV in Cameroon, Africa, the POWER Randomized Controlled Trial, published in PLOS Medicine. To test this hypothesis, researchers recruited 1,500 unmarried girls and young women involved in commercial or transactional sex. Half of them were randomly selected to receive free health insurance for themselves and their economic dependents. Over 12 months, 2,428 people, including 579 study participants and 1,849 economic dependents, received free healthcare at Hospital Cité Verte in Yaoundé, Cameroon, resulting in a total of 938 medical visits. After 12 months, the researchers observed that 1. In the group of women engaging in transactional sex, those provided with health insurance had an astounding 88% reduction in HIV incidence. Furthermore, 2. Women who received health insurance were 50% more likely to stop transactional sex. And 3. For those who continued engaging in transactional sex, this intervention still led to a significant 43% increase in condom use. However, the intervention showed no effect on female sex workers. In conclusion, this study is the first to show that the protection against negative income shocks is effective to prevent HIV infection amongst high-risk women in Africa. This scalable intervention holds promise for closing the gender gap in new HIV infections. How can this information be used to create positive change for women in Africa?
So what we find is quite amazing. So we find a huge reduction in HIV infection, and this very high effect shows that HIV in Africa is driven by economic reasons and notably by negative economic shocks. So those results are very important because they show that governments should also invest in the protection against negative economic shock in order to prevent HIV among women in their country.
Malheureusement au Cameroun, ces femmes du sexe transactionnel sont insuffisamment prises en compte dans les politiques de prévention du VIH. Il est donc essentiel que les programmes nationaux de prévention accordent aussi une attention particulière à ces groupes afin d'y réduire substantiellement les taux de transmission du VIH.